Let's talk about sleep apnea. It doesn't take a doctor to know that you're at your best when you're well rested. If you've ever been sleep deprived for several days in a row, you know what it feels like to be sluggish and foggy. What if I told you that despite getting enough sleep, you may still be sleep deprived? Sleep apnea is the most common sleep condition in North America. An analysis of 11 population-based studies between 1993 to 2013 found the prevalence of sleep apnea estimated at approximately 22% in the general population. That means 1 out of every 5 people suffered from sleep apnea, and the incidence is only going up. So why does sleep apnea matter? When people have sleep apnea, even if they're sleeping for 7 to 8 hours, their sleep is not restorative and they may wake up lethargic. So how does sleep apnea cause such a disturbance? The best way to answer that is by understanding the mechanism of sleep apnea. There are 2 types of sleep apnea, obstructive and central. Obstructive apnea occurs due to collapsing of the airway at the level of the throat. When we go to sleep, we lie down, and this angles our neck in a way where our throat narrows more so than when we're upright. When you add on the muscle relaxation associated with sleep, it's easier for the throat muscles to relax and close on themselves, resulting in airway blockage. When that blockage occurs, we're unable to breathe and we experience sleep apnea. Central apnea, on the other hand, is when the brain doesn't signal to breathe, which for multiple reasons is more likely to occur while we're asleep. These breathing events, as you can imagine, have negative consequences for both our sleep and our overall health. First of all, these breathing events cause arousals, which are short awakenings. We may not notice these and believe that we're sleeping through the night, but patients who have sleep apnea often wake up multiple times during the night without noticing. This fragmentation means the patient never got solid or consistent sleep. This results in all of the symptoms of sleep deprivation, including difficulty focusing, fatigue, increased risk of developing high blood pressure and heart disease, as well as an increased risk of developing dementia such as Alzheimer's in the future. One of the more common concerns of patients with sleep apnea is that they wake up multiple times during the night to urinate. In this situation, patients think that because they need to use the washroom, they wake up. However, there is a slightly more complex explanation for these frequent nighttime awakenings. Sleep apnea doesn't just interrupt your sleep by waking you up, it affects multiple biological pathways while you're asleep. First, when people stop breathing in their sleep, there is increased stress on the heart, resulting in part of it stretching. This stretching releases a hormone responsible for increased urine production. So the respiratory events cause hormone pathways to increase urine production, and then you have to wake up to urinate. The second mechanism is through the arousals themselves. Awakenings inhibit, which means to block, a hormone called antidiuretic hormone. This hormone blocks urine production. So by blocking the blocker, there is a signal to the kidneys to make more urine, which is why when people wake up in the middle of the night, they feel the urge to urinate. It's the awakening coming first here, not the need to urinate. In addition to the effects of sleep deprivation, these breathing events can also result in low oxygen levels because we stop breathing. These decreased oxygen levels over time cause damage to the brain, blood vessels, and heart. There have also been studies that show sleep apnea results in increased inflammatory markers. So how do we treat sleep apnea? This is a bit of a complex question, as there are multiple treatments for sleep apnea depending on the severity and corresponding symptoms. In patients who have mild sleep apnea, normal oxygen, and are completely asymptomatic with good energy levels during the day and solid sleep during the night, regular follow-up with a physician might be enough. However, as patients get into severe sleep apnea or show symptoms of sleep deprivation or low oxygen levels, treatment becomes more important. There are multiple treatment options for sleep apnea. The first is an oral appliance, a small device a dentist creates to hold back the tongue or push the jaw forward. This clears the airway, allowing adequate airflow through the throat. These dental devices have varying success rates and can be anywhere from 30 to 70% depending on the anatomy of someone's mouth and throat. The second is positional therapy. In a subset of patients with sleep apnea, it's particularly bad on their back and either mild or not even present on their sides. For these patients, positional therapy may be enough. This will often be a combination of using pillows or supports to keep the patient on their side while asleep. This is a simple yet effective way to treat sleep apnea, which is predominantly during sleep on the back. Third is weight loss. This can be helpful in treating sleep apnea and will often make it milder, but may not always treat it completely. Weight loss decreases the circumference of the neck, which alleviates the pressure on the throat when one lies down, which is why it can treat sleep apnea. However, due to the fact that everyone has slightly different facial anatomy, from the angle of the jaw to the size of the chin, some people may be predisposed to sleep apnea even at lower weights. This is why weight loss alone can have a positive but not always predictable effect on sleep apnea. The most effective treatment for sleep apnea is often positive pressure ventilation through a CPAP machine. This is a small machine that goes on the nightstand beside you while you're sleeping and connects through a hose to a mask that you wear. This machine gives you air pressure so that when your throat comes to collapse, that positive pressure keeps it open and you're able to take a proper breath. This is the most effective and reliable treatment. This may seem inconvenient for some patients at first, but most get used to the CPAP and within a few weeks often report being unable to sleep without it due to their improved sleep quality. In addition to these traditional ways of treating sleep apnea, there are other more invasive measures. There are multiple surgical interventions for sleep apnea, such as a surgery called a Uvulopalatopharyngioplasty, in which an ear, nose, and throat surgeon will remove part of your soft palate to clear the airway, or another kind of surgery where the jaw is moved forward. These surgeries are often less effective than the CPAP and are thus not preferred due to the inherent risk of surgery and lack of better outcomes compared to CPAP. They are often reserved for unique cases. One of the newer methods of treating sleep apnea is a small implant that stimulates the glossopharyngeal nerve, which is the nerve responsible for controlling some of the muscles in your throat. This glossopharyngeal nerve stimulator makes those muscles more active so that when you're sleeping, they're less likely to relax and the throat stays open. Overall, however, the treatment for sleep apnea is highly personalized and depends uniquely on each patient. While CPAP is the most effective, what works for some might not be best for others. So discussing your options with your doctor is very important. The information in this video doesn't constitute medical advice. If you have any questions regarding sleep apnea, please don't hesitate to ask your doctor.